Moving forward, how do you see yourself using AlphaFlo in your practice?
Well, I hope to use it a lot more down the road. I guess some of the other things, and I don't want to go into those, but I think there may actually be some other uses that come out of AlphaFlo. Of course, it's used for healing really nasty wounds that are very slow to heal. It can help speed those up. I haven't used it for situations like that at this point because I hadn't had any real situations that um, that would require it, or where I thought it was a good place to use it. But I'm anticipating using it on some other things down the road.
Excellent. Well, that's good to hear. What would you say to veterinarians who have not yet tried AlphaFlo?
I think it's as any new product comes on the market, we should all be reasonably skeptical of anything, but we also can, if we can help our patients in any way, I think this is something worthwhile that other veterinarians should consider. Um, in some of the limited things I've used it for, um, I've been I've been very happy with some of the results I've seen. Um, I mean, there's sometimes you get patients that have, their bodies are you may get them in an advanced condition where they're not as receptible to the benefits of it as they might have been if had the product been available or been used uh, earlier in their disease onset in their joints and other issues that they're having.
Well, that makes sense. And I will tell you, I used it on my 18-year-old dog's elbow. And wow, it has given her life. So even at 18 years old, she is just given a new lease on her life. It's been so fun to watch that. So I personally am really excited that you're working with older dogs and that it gives them, just more joy and just activity in their life.
Well, I think, and also the younger dogs, especially the ones that have injuries that had to have surgical corrections, I think it can sure help them heal faster, maybe better, and maybe time will tell if it helps prevent some of the chronic arthritic problems that result, especially in the knees from some of these dogs that tear their knees up or have other joint injuries at a young age. Uh, that's going to be that could be an eye opener or a game changer if we can prevent some of the arthritic problems that might occur down the road in some of these patients. I think everybody should at least be aware that it's there, that you can use it in certain situations. Um, and again, I just really, I've been very pleased in a lot of my patients. There's some that haven't responded, one or two that didn't respond quite the way I would like to have them done. But again, those may have had some injuries that had been long-standing with arthritic problems that didn't just crop up. They'd been accumulating over many years. And on those, you might not see the response that some of these other that seem so dramatic that I've seen. Um, there's going to be ones that really respond well and then others that don't respond as well as we would like for them to. But no medication's 100%.
And that's a message we want to share as well, that if it's an injury, don't wait. Would you say that sooner would be better once there's an injury versus letting a lot of time go by?
Oh, I would always want to do it as soon as possible because then some of the chronic things that you can't correct are going to occur, and your response to the medication is not going to be anywhere near as good.
That's a great point. Thank you.